Question 1. What is the main purpose of conducting a preference assessment with a client? A. To see if they can follow instructions. B. To find out what items or activities may be reinforcing for the client. C. To determine the function of a challenging behavior. D. To teach the client how to make choices. Answer: B. To find out what items or activities may be reinforcing for the client. This question is asking about the fundamental reason why we do preference assessments. The key idea is that we want to discover what motivates a client, what they like, because those things can be used as rewards, reinforcers, to encourage learning and good behavior. A preference assessment is a way to systematically present different items or activities to see which ones the client prefers. It's not about checking instruction following. A. Figuring out why a behavior happens. C. That's a functional assessment, or teaching the skill of choosing. D. Although they might learn to choose better over time. It's all about finding those potential rewards. Think of it as finding the client's favorite things so you can use them to make therapy fun and effective. Question 2. In the three-term contingency, ABC, what does the C stand for? A. Control. B. Cause. C. Consequence. D. Criteria. Answer: C. Consequence. This question is about the basic building blocks of understanding behavior in ABA, the ABCs. The C stands for consequence. A consequence is what happens immediately after a behavior occurs. Consequences are really important because they determine whether the behavior is more or less likely to happen again in the future. The A is the antecedent, what happens before, and the B is the behavior itself. Understanding the consequences helps us understand the function of the behavior. Remember, C comes right after B in the ABCs and in the behavior chain. Question 3. Which measurement method involves counting the number of times a specific behavior occurs? A. Duration. B. Latency. C. Frequency. D. Interval recording. Answer: C. Frequency. This question asks about a basic way to measure behavior. Counting. Frequency measurement is simply counting how many times a target behavior happens within a specific observation period. It's used for behaviors that are discrete, meaning they have a clear start and end, like hitting, saying a word, or raising a hand. Duration. A. Measures how long a behavior lasts. Latency. B. Measures the time until a behavior starts. Interval recording. D. Samples behavior during specific time blocks. If you need to count how many, you use frequency. Question 4. What is the primary ethical responsibility of an RBT regarding client information? A. To share information with the client's family. B. To maintain confidentiality of the information. C. To use the information for research. D. To store the information in your home. Answer: B. To maintain confidentiality of the information. This question is about a fundamental ethical duty for RBTs, keeping client information private. Confidentiality means protecting all sensitive information about your client, including their identity, diagnosis, treatment details, and progress. You should only share information with authorized people who have a legitimate need to know, like your supervisor or other members of the client's treatment team. Following proper procedures, sharing freely with family, A, or for research, C, requires specific consent. Storing information unsafely, D, violates security protocols. Protecting client privacy is key. Keep client information secret unless you have permission to share it with specific people involved in their care. Question 5. What is the term for a consequence that, when something is removed immediately following a behavior, makes that behavior more likely to occur in the future? A. Positive punishment. B. Negative punishment. C. Positive reinforcement. D. Negative reinforcement. Answer: D. Negative reinforcement. This question asks about negative reinforcement. Reinforcement means the behavior increases, happens more often, And negative means something is taken away or removed. So, negative reinforcement is when a behavior is strengthened because it leads to the removal or avoidance of an unpleasant, aversive stimulus. For example, pressing a button, behavior, turns off a loud noise. Aversive stimulus removed. If pressing the button increases in the future, it's negative reinforcement. The behavior works because it makes something bad go away. Question 6. Which professional is responsible for designing a client's behavior intervention plan and skill acquisition programs? A. The Registered Behavior Technician, RBT. B. The client's parent or guardian. C. The Board Certified Behavior Analyst, BCBA. Or Board Certified Assisted Behavior Analyst, BCABA. D. A school teacher or psychologist. Answer: C. The Board Certified Behavior Analyst, BCBA, or Board Certified Assisted Behavior Analyst, BCABA. This question clarifies the roles on an ABA team. RBTs are trained to implement plans, but they do not design them. The responsibility for conducting assessments, developing comprehensive behavior intervention plans, BIPs, and skill acquisition programs, and providing supervision to the RBTs rests with the certified BCBA or BCABA. Parents, teachers, or other professionals, a B, D, are valuable team members, but are not certified to perform the role of behavior analytic program design and supervision. The BCBA or BCABA is the lead clinician who creates the plans you follow. Question 7. When using a token economy, what is the purpose of the tokens? A. To serve as primary reinforcers immediately. B. To be exchanged later for backup reinforcers. C. To function as punishers for challenging behavior. D. To signal when reinforcement is available. Answer: B. To be exchanged later for backup reinforcers. This question is about how a token economy system works. Tokens, or points, stickers, etc., are conditioned reinforcers. They don't have inherent value but gain value because they can be collected and later traded for things the client actually wants. Backup reinforcers, such as toys, activities, or edibles, they are earned immediately for target behaviors and exchanged later. They aren't primary reinforcers. A. Punishers. C. Or SDs. D. Tokens are like money you earn for good behavior and can trade for prizes. Question 8. What is the term for what happens immediately after a behavior, which influences the future likelihood of that behavior? A. Antecedent. B. Behavior. C. Consequence. D. Stimulus. Answer: C. Consequence. This is another look at the ABCs. The consequence is the event that follows a behavior. Consequences determine if the behavior will happen more often, reinforcement, or less often, punishment, in the future. Antecedents: A. Come before behavior. B. Is the action and stimulus. D. Is a broad term for any environmental event. Consequences are key to why behaviors continue or stop. What happens right after the behavior changes if it will happen again? Question 9. Which measurement method involves recording the time that passes from the moment a stimulus, like an instruction, is presented to the moment the client starts the target behavior? A. Duration. B. Latency. C. Interresponse time, IRT. D. Frequency. Answer: B. Latency. This question asks about measuring the speed of responding after a cue. Latency is the time between the presentation of a stimulus, like touch your nose, and the initiation or start of the client's response, when they begin to move their hand towards their nose. Duration, A, is how long the nose touch lasts. IRT, C, is the time between two nose touches. Frequency, D, is counting how many times they touch their nose. Latency measures the delay before they start the behavior. It's the lag time between the signal and the start of the action. Question 10. When is it ethically mandatory for an RBT to report suspected abuse or neglect of a client? A. Only if the supervisor instructs them to. B. Only if they are absolutely certain it occurred. C. Immediately following agency policy and mandated reporting laws. D. Only if the client is a child. Answer: C. Immediately following agency policy and mandated reporting laws. This question is about mandatory reporting, a critical ethical and legal obligation for RBTs. If you have reason to suspect abuse or neglect of a client, child, or adult, you are legally required to report it. You should follow your agency's specific protocol, which typically involves reporting to your supervisor immediately and may also require you to report directly to the appropriate state protective services agency. Waiting for instruction from the supervisor, A, or for certainty, B, is unethical and illegal. Mandated reporting applies to vulnerable individuals regardless of age. D, if you suspect abuse or neglect, you must report it right away. Client safety is the top priority. Question 11. Which type of behavior reduction procedure involves withholding the reinforcement that previously maintained a behavior, leading to a decrease in that behavior over time? A. Punishment. B. Extinction. C. Response cost. D. Timeout. Answer: B. Extinction. This question asks about the procedure where a behavior decreases because it no longer gets the reward it used to. Extinction is implemented by identifying the specific reinforcer maintaining a behavior and then stopping the delivery of that reinforcer following the behavior. This causes the behavior to decrease in frequency over time. Punishment. A. Decreases behavior by adding something aversive or removing something pleasant as a consequence. Response cost. C. And timeout. D are specific forms of punishment or procedures involving reinforcement removal from the environment. Extinction is about stopping the reinforcement that was making the behavior happen. When the reward stops, the behavior decreases. Question 12. When using a least to most prompting strategy, you start by providing A. The most intrusive prompt needed for the client to respond correctly. B. A verbal prompt first, then increase if needed. C. The least intrusive prompt needed, increasing assistance only if necessary. D. Any prompt the client seems to prefer. Answer: C. The least intrusive prompt needed, increasing assistance only if necessary. This question is about the starting point and process of least to most, LTM, prompting. In LTM, you begin with the minimal amount of assistance you think the client might need, which could be no prompt, just the SD. If they don't respond correctly after a short waiting period, you then provide the next prompt in your predetermined hierarchy, which is slightly more intrusive, and continue increasing the prompt level until the client responds correctly. Option A. Describes most to least. Option B. Describes a specific sequence, not the general strategy. Option D isn't standard practice for prompting effectiveness. Start with the least amount of help and only add more if they need it. Give just enough help and only increase it if they don't get it. Question 13. What is the definition of duration measurement? A. Recording how long a behavior lasts from start to finish. B. Counting the number of times a behavior occurs. C. Recording the time between the start of a stimulus and the start of a behavior. D. Recording how much time passes between two occurrences of the same behavior. Answer: A. Recording how long a behavior lasts from start to finish. This question asks for the definition of duration measurement. Duration is used for behaviors that occur continuously for a period of time, and you are interested in how long each instance of the behavior lasts. You would measure the time from the moment the behavior begins until the moment it ends. Option B is frequency. Option C is latency. Option D is IRT. Duration measures the length of the behavior. Question 14. Which ethical guideline requires RBTs to accurately collect and report data? A. Confidentiality. B. Integrity. C. Professional boundaries. D. Responsibility. Answer: B. Integrity. This question is about the ethical principle of honesty, specifically applied to data handling. Integrity means being truthful, accurate, and honest in all your professional activities, which absolutely includes collecting data precisely as instructed and reporting it accurately, without any manipulation or falsification. Confidentiality, A, is privacy. Professional boundaries, C, are about relationships. Responsibility, D, is about fulfilling duties. Your honesty is key when it comes to data. Be honest and accurate with your data collection and reporting. Question 15. What is the term for a stimulus that signals that reinforcement is available for a specific behavior? A. S delta, SD. B. Motivating operation, MO. C. Conditioned reinforcer. D. Discriminative stimulus, SD. Answer: D. Discriminative stimulus, SD. This question asks for the term for a stimulus that acts as a cue for behavior that will be reinforced. The discriminative stimulus, SD, is an antecedent stimulus that indicates that if a specific behavior is performed in its presence, it will be followed by reinforcement. It sets the occasion for the behavior to occur because the person has learned that the behavior pays off in the presence of this stimulus. And S delta, A, signals reinforcement is not available. And MO, B, changes the value of the reinforcer. A conditioned reinforcer, C, is a type of reward. The SD is the green light telling you can get the reward now if you do the behavior. Question 16. What is the definition of shaping? A. Teaching a client a sequence of steps to complete a complex skill. B. Reinforcing behaviors that are closer and closer approximations to the target behavior. C. Providing reinforcement only when a behavior occurs in the presence of a specific stimulus. D. Using prompts to help a client perform a behavior. Answer: B. Reinforcing behaviors that are closer and closer approximations to the target behavior. This question asks for the definition of shaping, a procedure used to teach new behaviors that the client doesn't currently perform. Shaping involves reinforcing behaviors that are progressively closer to the desired target behavior, gradually withholding reinforcement for less accurate approximations. Task analysis and chaining, A. Teach multi-step skills. Discrimination, C, is responding to specific stimuli. Prompting, D, is providing help. Shaping is like sculpting a behavior step by step. Question 17. Which type of generalization occurs when a client performs a learned behavior in the presence of stimuli or settings that are different from the original training environment? A. Response generalization. B. Stimulus generalization. C. Discrimination. D. Maintenance. Answer: B. Stimulus generalization. This question asks about stimulus generalization. Stimulus generalization happens when a behavior learned in one specific situation occurs in other similar situations or environments with different people or materials, even though it wasn't directly taught in those new situations. The stimulus changes, but the behavior still happens. Response generalization, A, is doing different behaviors that have the same function. Discrimination, C, is responding differently to different stimuli. Maintenance, D, is the skill lasting over time. The behavior happens in a new place or with new things. Question 18. What is the potential negative outcome of implementing a behavior reduction procedure inconsistently? A. The challenging behavior may decrease too quickly. B. The challenging behavior may become more resistant to change. C. The client may learn the alternative behavior too easily. D. Data collection will become too easy. Answer: B. The challenging behavior may become more resistant to change. This question addresses the critical importance of consistency in implementing behavior plans, especially for reducing challenging behavior. Inconsistent implementation example, sometimes reinforcing the challenging behavior unintentionally, or sometimes using extinction, and sometimes not, can inadvertently create an intermittent reinforcement schedule for the challenging behavior. Intermittent schedules make behaviors more durable and resistant to extinction, making it harder to decrease the behavior in the long run. Consistency is key to making the plan work. If you don't follow the plan the same way every time, the behavior might become harder to change later. Question 19. When should an RBT seek supervision? A. Only during scheduled supervision meetings. B. Only when they have a problem with a client's behavior. C. Whenever they are unsure about implementing a procedure or have questions about a client's case. D. Only when asked to bind their supervisor. Answer: C. Whenever they are unsure about implementing a procedure or have questions about a client's case. This question is about when and why RBTs should communicate with their supervisor. While scheduled supervision is required, you should proactively reach out to your supervisor anytime you are unsure about a procedure, encounter a new situation, need clarification on a plan, or have questions about a client's progress or behavior. Waiting only for problems, B, or scheduled times, A, is not sufficient. Waiting to be asked, D, means you aren't taking responsibility for seeking necessary guidance. Your supervisor is there to support you and ensure quality services. Don't wait if you have questions or are unsure. Ask your supervisor. Question 20. Which type of measurement is used for behaviors that occur for a continuous period of time, and you want to record how long each instance lasts? A. Frequency. B. Latency. C. Duration. D. Inter-response time. IRT. Answer: C. Duration. This question asks about measuring the length of a behavior. Duration measurement is used for behaviors that last for a continuous period of time, such as crying, tantruming, engaging in a specific activity, or sitting in a seat. You measure from the beginning to the end of the behavior. Frequency. A. Is counting. Latency. B. Is time to start. IRT. D. Is time between instances. Use duration to see how long the behavior lasts. Question 21. What is the definition of a reinforcement schedule? A. The type of reinforcer used for a behavior. B. The plan for decreasing a challenging behavior. C. The rule that determines when reinforcement is delivered for a behavior. D. The time of day when therapy sessions occur. Answer: C. The rule that determines when reinforcement is delivered for a behavior. This question asks for the definition of a reinforcement schedule. A reinforcement schedule is a rule that specifies which instances of a behavior will be reinforced. It determines how often or when reinforcement is delivered. Example: every time, every few times, after a certain time. Different schedules produce different patterns of behavior. The type of reinforcer, A, is separate. Behavior plans, B, include schedules, but the schedule is a component of the plan. Session times, D, are about scheduling therapy, not reinforcement. The schedule tells you when the behavior will get a reward. Question 22. When graphing data, what does the x-axis, horizontal axis, typically represent? A. The behavior being measured. B. The value of the behavior, count, duration, etc. C. Time example sessions, days, dates. D. The intervention phase. Answer: C. Time example sessions, days, dates. This question is about reading graphs in ABA. On a standard line graph used to track behavior change, the x-axis, the bottom horizontal line, always represents the passage of time. This allows you to see how the behavior changes over time. The y-axis, B, represents the measurement of the behavior. The behavior, A, and intervention phase, D, are represented by the plotted data points and phase change lines on the graph. The x-axis is the timeline of your graph. Question 23. Which ethical guideline requires RBTs to only perform tasks within their defined role and competence under supervision? A. Integrity. B. Professional boundaries. C. Scope of practice. D. Responsibility. Answer: C. Scope of practice. This question asks about working within your training and job description. Your scope of practice defines the range of responsibilities and procedures you are qualified and authorized to perform as an RBT under supervision. Ethically, you must stay within this scope. Integrity. A. Is honesty. Professional boundaries. B. Are about relationships. Responsibility. D. Is about fulfilling duties. Know what your job is and stick to doing what you're trained to do. Question 24. What is the difference between a primary reinforcer and a conditioned reinforcer? A. Primary reinforcers are learned. Conditioned reinforcers are unlearned. B. Primary reinforcers increase behavior. Conditioned reinforcers decrease behavior. C. Primary reinforcers are naturally reinforcing, unlearnedly. Conditioned reinforcers are learned through pairing. D. Conditioned reinforcers are always stronger than primary reinforcers. Answer: C. Primary reinforcers are naturally reinforcing, unlearned. Conditioned reinforcers are learned through pairing. This question asks you to distinguish between unlearned and learned reinforcers. Primary, or unconditioned, reinforcers, like food or water when hungry, are naturally reinforcing because they satisfy biological needs. Their value does not need to be learned. Conditioned, or secondary, reinforcers, like praise or tokens, become reinforcing because they have been consistently paired with other reinforcers. Option A reverses the definitions. Option B describes reinforcement as punishment. Option D is not true. Strength varies. Primary is natural. Conditioned is learned. Question 25. Which behavior reduction procedure involves removing a stimulus that was previously earned by or provided to the client, contingent on a behavior, resulting in a decrease in that behavior? A. Extinction. B. Timeout. C. Response cost. D. Negative reinforcement. Answer: C. Response cost. This question describes response cost, a type of negative punishment. Response cost involves taking away a specific amount of a reinforcer that the client already has or has earned, like losing tokens, points, or having a privilege removed. Immediately after a challenging behavior occurs, this loss of reinforcement makes the behavior less likely in the future. Extinction, A, is withholding reinforcement that maintained the behavior, not necessarily taking away something already possessed. Timeout, B, is removing from a reinforcing environment. Negative reinforcement, D, increases behavior. The behavior costs the client something they had. Question 26. What should an RBT do if they witness or suspect unethical behavior by a colleague? A. Talk to the colleague directly about the issue. B. Ignore it if it doesn't directly involve their client. C. Document the incident and report it to their supervisor. D. Report the colleague to the BACB immediately. Answer: C. Document the incident and report it to their supervisor. This question addresses ethical responsibilities when observing misconduct by others. While difficult, ethical guidelines require RBTs to address suspected unethical behavior. The most appropriate step is to document what you observed clearly and objectively and report it promptly to your supervisor. They are responsible for addressing personnel issues and ensuring ethical conduct among their staff. Talking directly, A, might not be effective or safe. Ignoring it, B, is unethical if it risks client well-being or violates standards. Reporting directly to the BACB. D might be necessary in severe cases or if the supervisor doesn't address it, but reporting to the supervisor is usually the required first step. Report it to your supervisor and let them handle it. Question 27. When is it acceptable to use potentially restrictive interventions for challenging behavior? A. If the behavior is severe and less restrictive options have been attempted and found ineffective. B. If the client's parents request it as the first course of action. C. If it is the easiest procedure to implement. D. Only if the behavior poses immediate physical danger. Answer: A. If the behavior is severe and less restrictive options have been attempted and found ineffective. This question relates to the ethical principle of using the least restrictive effective intervention. Behavior analysts should always try less intrusive methods first. More restrictive procedures are considered only when the behavior is serious, example, dangerous, significantly interfering with learning/life, and after less restrictive, evidence-based interventions have been implemented consistently and shown to be ineffective in reducing the behavior to an acceptable level. Parent requests, B, or ease of use, C, are not sufficient reasons, while danger, D, is a strong reason. Significant interference with life or learning also warrants considering effective options. Use the least amount of restriction that works, and only increase if less restrictive options fail for a significant problem behavior. Question 28. Which type of graph is typically used in ABA to display continuous data and show trends over time? A. Bar graph. B. Line graph. C. Pie chart. D. Scatter plot. Answer: B. Line graph. This question asks about the standard graph type in ABA. Line graphs are used to show how a behavior measure, like frequency, duration, rate, changes across successive observation periods, like sessions, days. The line connecting the data points allows for easy visual analysis of trends, increasing, decreasing, stable, and variability. Bar graphs. A. Compare different categories. Pie charts. C. Show proportions. Scatter plots. D. Show relationships between two variables. Line graphs are your main tool for seeing progress over time. Question 29. What is the term for a stimulus that is present when a behavior is not reinforced? A. SD. Discriminative stimulus. B. S delta. SD. C. Motivating operation. MO. D. Conditioned reinforcer. Answer: B. S delta. SD. This question asks for the term for the stimulus that signals a behavior will not be reinforced. An S delta is an antecedent stimulus that indicates that a specific behavior will not be reinforced if performed in its presence. It's the red light signaling that the reward is not coming for that behavior right now. An SD, A, signals reinforcement is available. An MO, C, changes reinforcer value. A conditioned reinforcer, D, is a type of learned reward. An S delta tells you no reward now for that behavior. Question 30. When teaching a multi-step skill, what is the purpose of a task analysis? A. To determine the function of the behavior. B. To identify potential reinforcers for the client. C. To break the skill down into smaller, teachable steps. D. To decide which prompt to use. Answer: C. To break the skill down into smaller, teachable steps. This question asks about the purpose of a task analysis when teaching complex skills. A task analysis is the process of breaking a skill composed of a sequence of behaviors into individual steps. This makes the skill easier to teach and allows for data collection on each step. Function: A, is from FBA. Reinforcers: B, are from preference assessments. Prompting: D, is a teaching strategy, not the analysis itself. A task analysis breaks down big skills into small steps you can teach. Question 31. What is the definition of negative punishment? A. Decreasing a behavior by removing something pleasant. B. Decreasing a behavior by presenting something aversive. C. Increasing a behavior by removing something aversive. D. Increasing a behavior by presenting something pleasant. Answer: A. Decreasing a behavior by removing something pleasant. This question asks for the definition of negative punishment. Punishment means the behavior decreases, and negative means something is taken away or removed. So, negative punishment is when a behavior becomes less likely in the future because a pleasant stimulus is removed immediately after it occurs. For example, taking away a toy, pleasant stimulus removed. When a child throws it, behavior. If throwing decreases, it was negative punishment. Taking away something good to make the behavior happen less is negative punishment. Question 32. When using discrete trial training, DTT, each trial should begin by A. Presenting the reinforcer. B. Gaining the client's attention. C. Recording data. D. Presenting the consequence. Answer B. Gaining the client's attention. This question asks about the initial step in a standard DTT trial. For a DTT trial to be effective, the client must be attending to the therapist before the instruction, SD, is presented. Gaining attention ensures they are ready to receive the cue to respond. Presenting reinforcement, A, and consequence, D, happen after the response. Recording data, C, happens after the consequence. Make sure the client is looking and ready before you give the instruction. Get their attention first. Question 33. What is the term for a temporary increase in the frequency, intensity, or variability of a behavior when an extinction procedure is first implemented? A. Spontaneous recovery. B. Behavior contrast. C. Extinction burst. D. Ratio strain. Answer C. Extinction burst. This question asks about a common and predictable side effect when you stop reinforcing a behavior. An extinction burst is a temporary phenomenon where the behavior that is no longer being reinforced gets worse, more frequent, stronger, or takes different forms, before it starts to decrease. It's like the client is trying harder to get the reinforcement that used to work. Spontaneous recovery, A, happens after the behavior has already decreased. Behavior contrast, B, involves changes in behavior in different settings. Ratio strain, D, relates to thinning reinforcement schedules too quickly. Expect the behavior to get worse before it gets better when you stop rewarding it. Question 34. What is the ethical guideline that prohibits RBTs from accepting gifts from clients or their families, especially if the value is significant? A. Confidentiality. B. Dual relationships/professional boundaries. C. Integrity. D. Beneficence. Answer B. Dual relationships/professional boundaries. This question addresses the ethical issue of accepting gifts. Accepting gifts from clients or their families can blur professional boundaries and create dual relationships, potentially leading to conflicts of interest, compromising objectivity, or exploitation. Ethical guidelines generally advise against accepting gifts, particularly those of significant monetary value. Confidentiality, A, is privacy. Integrity, C, is honesty. Beneficence, D, is doing good. Avoid accepting gifts that could complicate your professional relationship. Don't accept gifts that make your professional relationship fuzzy. Question 35. When visually analyzing data on a graph, what does variability refer to? A. How much the data points bounce around. B. The overall direction of the data path. C. The average value of the data points. D. When the intervention was changed. Answer. A. How much the data points bounce around. This question asks about interpreting variability on a graph. Variability refers to the extent to which the data points are spread out or fluctuate around the trend line or average level within a phase. High variability means the behavior is inconsistent or unstable. Trend, B, is the direction. Level, C, is the average value. Phase changes, D, are marked by lines. Jumpy data means high variability. Question 36. What is the definition of a primary reinforcer? A. A stimulus that has become reinforcing through pairing with other reinforcers. B. A stimulus that is naturally reinforcing because it satisfies a biological need. C. A stimulus that is preferred by the client in an assessment. D. A stimulus that is used most often in therapy. Answer. B. A stimulus that is naturally reinforcing because it satisfies a biological need. This question asks for the definition of a primary reinforcer, primary or unconditionity. Reinforcers are stimuli that are reinforcing without any prior learning history because they meet basic biological needs, example, food, water, shelter, sleep, pain reduction. Their reinforcing value is unlearned. Option A describes a conditioned reinforcer. Option C is a result of preference assessment, but preference doesn't guarantee it's a primary reinforcer. Option D relates to frequency of use, not definition. Primary reinforcers are the basic, natural rewards needed for survival or comfort. Question 37. Which prompting strategy starts with the most intrusive prompt and gradually fades to less intrusive prompts? A. Least to most prompting. B. Most to least prompting. C. Time delay prompting. D. Simultaneous prompting. Answer. B. Most to least prompting. This question asks about the prompting strategy that begins with the most help. In most to least, MTL, prompting, you start by providing a prompt that ensures the client will perform the behavior correctly, often a physical or full model prompt. As the client begins to respond independently or with less help, you systematically reduce the intrusiveness of the prompt, fade the prompt. Over trials, least to most, A starts with the least intrusive. Time delay, C, and simultaneous, D are different fading procedures. Start with the most help and gradually reduce it. Question 38. What is the main purpose of collecting baseline data? A. To measure the behavior after the intervention. B. To compare the level of behavior before the intervention to the level during or after the intervention. C. To teach the client how to engage in the target behavior. D. To identify the function of the behavior. Answer. B. To compare the level of behavior before the intervention to the level during or after the intervention. This question asks about the reason for collecting data before starting an intervention. Baseline data is collected on the target behavior before any intervention is implemented. It provides a measure of how often, how long, or under what conditions the behavior naturally occurs without any planned changes. This baseline serves as a critical point of comparison to determine if the intervention is effective in changing the behavior. Measuring after intervention, A, is part of ongoing data collection. Teaching, C, is skill acquisition. Identifying function, D, is FBA. Baseline shows you where you started so you can see if you've made progress. Question 39. Which ethical guideline emphasizes using behavior analytic procedures that are supported by scientific research? A. Integrity. B. Confidentiality. C. Evidence-based practice. D. Responsibility. Answer. C. Evidence-based practice. This question asks about the ethical requirement to use scientifically validated methods. Evidence-based practice means using interventions and procedures that have demonstrated effectiveness through research, combined with clinical expertise and client values. It's an ethical obligation to use treatments that are likely to work for the client. Integrity, A, is honesty. Confidentiality, B, is privacy. Responsibility, D, is duty. Use treatments that research shows are effective for the client. Question 40. What is the definition of inter-observer agreement, IOA? A. Two or more observers agreeing on the definition of a behavior. B. Two or more observers independently collecting data on the same behavior and comparing their results. C. Two or more observers agreeing on the function of a behavior. D. A measurement of how well the intervention is implemented. Answer B. Two or more observers independently collecting data on the same behavior and comparing their results. This question asks for the definition of IOA. IOA is a way to check data reliability. It involves having at least two people watch the same behavior at the same time and independently record data using the same measurement system. Their data is then compared to see how much they agreed. This indicates whether the data is consistent and the behavior definition is clear. Agreeing on the definition, A, is important for IOA, but isn't the definition of IOA itself. Agreeing on function, C, is part of FBA. Measuring implementation fidelity, D, is different from IOA. IOA is having multiple people collect data separately and then comparing their numbers. Question 41. When using total task chaining, reinforcement is delivered after the client independently completes. A. Only the very first step of the task analysis. B. Only the very last step of the task analysis. C. All of the steps in the task analysis, regardless of prompting needed. D. Any step in the task analysis. Answer C. All of the steps in the task analysis, regardless of prompting needed. This question asks about reinforcement in total task chaining. In total task chaining, the RBT prompts the client through every single step of the task analysis during each attempt, providing assistance as needed. Reinforcement is provided only upon the successful completion of the entire chain of steps. Forward chaining, A, and backward chaining, B, reinforce completion of specific steps or parts of the chain. Reinforcing any step, D, isn't standard chaining. The reward is for finishing the whole sequence, even if you helped along the way. Question 42. What is the definition of response generalization? A. Performing a learned skill in new environments. B. Performing different behaviors that serve the same function. C. Responding differently to different stimuli. D. Maintaining a learned behavior over time. Answer B. Performing different behaviors that serve the same function. This question asks for the definition of response generalization. Response generalization occurs when a client learns a specific behavior in a situation, and then also performs different, but related behaviors that achieve the same outcome or function in that situation. For example, if a child learns to ask for juice by saying juice, they might also start saying, "I want juice," or using a picture card for juice. These are different responses that all get the same result, juice. Stimulus generalization, A, is doing the same behavior in new situations. Discrimination, C, is responding differently to different stimuli. Maintenance, D, is the skill lasting over time. Different actions get the same outcome. Question 43. What is the ethical responsibility of an RBT if a supervisor asks them to implement a procedure they are not trained to do? A. Attempt the procedure to demonstrate willingness. B. Inform the supervisor that they are not trained and request training and supervision. C. Refuse to work with the client. D. Ask a colleague for help instead of the supervisor. Answer B. Inform the supervisor that they are not trained and request training and supervision. This question addresses the RBT's ethical obligation regarding their scope of practice and competence. You must only perform tasks you are trained and competent to do. If your supervisor asks you to implement a new procedure, you must inform them if you have not received specific training and supervision on that procedure and request it before working with the client on it. Attempting it untrained, A, is unethical and potentially harmful. Refusing to work with the client entirely, C, might not be necessary. Asking a colleague, D, doesn't provide the required formal training and supervision from your direct supervisor. It's your responsibility to get trained by your supervisor for anything new. Question 44. Which measurement method involves recording the amount of time that elapses between the end of one instance of behavior and the beginning of the next instance of the same behavior? A. Duration. B. Latency. C. interresponse time, IRT. D. Frequency. Answer C. Interresponse time, IRT. This question asks for the definition of IRT, similar to Q33, but with the more common end-to-start phrasing. Interresponse time, IRT, is a continuous measurement of the time between two consecutive occurrences of the same behavior. It measures how much time passes between one instance of the behavior stopping and the next instance of that same behavior starting. Duration, A, is how long one instance lasts. Latency, B, is time from a stimulus to the first behavior. Frequency, D, is a count. IRT measures the gap in time between behaviors. Question 45. When using extinction for a challenging behavior, what is the most important thing to identify first? A replacement behavior to teach. B, the function of the challenging behavior. C, how often the behavior occurs. D, a preferred punisher. Answer B, the function of the challenging behavior. This question asks what you need to know to implement extinction effectively. Extinction involves withholding the specific reinforcement that is maintaining the behavior. To do this, you must first understand why the behavior is happening, its function. For example, if hitting is for attention, extinction means withholding attention. If it's for escape, extinction means preventing escape. Without knowing the function, you won't know what reinforcement to withhold. Teaching a replacement behavior, A, is crucial alongside extinction, but you need the function to choose an effective replacement. Frequency, C, is measurement. Punishment, D, is a different procedure. You need to know why the behavior is happening to figure out what reward to stop giving. Question 46. What is the ethical responsibility of an RBT regarding their required supervision? A, to attend supervision only if they feel they need help. B, to meet the minimum supervision requirements and actively participate in supervision sessions. C, to provide clinical recommendations to their supervisor. D, to pay for their own supervision. Answer B, to meet the minimum supervision requirements and actively participate in supervision sessions. This question addresses the RBT's role regarding supervision. RBT certification requires specific minimum hours of supervision per month from a qualified BCBA or BCABA. Ethically, the RBT is responsible for ensuring these requirements are met and actively engaging in the supervision process by coming prepared, asking questions, and discussing their cases and data. Attending only when problems arise, A, isn't sufficient. Providing clinical recommendations, C, is outside the RBT scope. Payment, D, depends on the agency, but the responsibility for receiving it does not. You are required to get your supervision and be an active part of it. Question 47. What is the ethical principle that requires RBTs to promote the well-being of their clients? A, integrity. B, non-maleficence. C, beneficence. D, responsibility. Answer C, beneficence. This question asks about the ethical principle of doing good. Beneficence means acting in the best interest of the client and promoting their welfare. This principle guides all aspects of service delivery, from choosing goals to implementing procedures. Integrity, A, is honesty. Non-maleficence, B, is avoiding harm, often paired with beneficence. Responsibility, D, is fulfilling duties. Your ethical duty is to work towards what is good for the client. Question 48. When conducting a paired stimulus, forced choice, preference assessment, how many items are presented to the client on each trial? A, 1. B, 2. C, 3. D, more than 2. Answer B, 2. This question asks about the defining feature of the paired stimulus preference assessment. In this method, items are presented in pairs, and the client chooses one from each pair. The chosen item is recorded, and items are systematically paired with every other item. Presenting 1, A, is single stimulus. presenting more than two. C, D, is part of multiple stimulus methods. Paired stimulus means presenting choices in pairs. You always give them two things to choose between. Question 49. What is the main difference between positive reinforcement and positive punishment? A. Positive reinforcement adds a stimulus. Positive punishment removes a stimulus. B. Positive reinforcement increases behavior. Positive punishment decreases behavior. C. Positive reinforcement is preferred by clients. Positive punishment is disliked by clients. D. Positive reinforcement involves primary reinforcers. Positive punishment involves conditioned punishers. Answer B. Positive reinforcement increases behavior. Positive punishment decreases behavior. This question asks for the key difference between these two positive contingencies. Both positive reinforcement and positive punishment involve adding a stimulus following a behavior. However, positive reinforcement increases the future likelihood of the behavior, while positive punishment decreases the future likelihood of the behavior. Option A describes positive vs. negative contingencies. Option C describes typical reactions but not the functional definition. Option D is not necessarily true. Both can involve conditioned or unconditioned stimuli. Reinforcement makes behavior go up. Punishment makes behavior go down. Question 50. What is the purpose of a phase change line on a graph in ABA? A. To separate different types of behavior measurement. B. To indicate the beginning of a new intervention or condition. C. To show when the client reached mastery of a skill. D. To mark when IOA was collected. Answer B. To indicate the beginning of a new intervention or condition. This question asks about the function of phase change lines in graphing. A vertical phase change line on a line graph indicates a significant change in the experimental conditions or intervention being implemented. This allows for visual analysis of the behavior before and after the change. Different measurement types. A. Might use different graphs or be plotted separately. Mastery. C. Is shown by the data reaching a criterion level. IOA. D is often plotted as separate points. A phase change line shows you when something important about the therapy changed. Question 51. What is the ethical guideline that prohibits RBTs from having romantic or sexual relationships with clients or their families? A. Confidentiality. B. Dual relationships/professional boundaries. C. Integrity. D. Non-maleficence. Answer B. Dual relationships/professional boundaries. This question specifically asks about one type of inappropriate relationship. Romantic or sexual relationships with clients or their families are a severe ethical violation, falling under the category of prohibited dual relationships and violations of professional boundaries. This compromises objectivity, creates a significant power imbalance, and is exploitative. Confidentiality. A. Is privacy. Integrity. C. Is honesty. Non-maleficence. D. Is avoiding harm. Romantic or sexual relationships with clients or their families are strictly prohibited. Question 52. When using differential reinforcement of other behavior, DRO, you are reinforcing A. The challenging behavior at a lower rate. B. A specific alternative behavior. C. A behavior that is physically incompatible with the challenging behavior. D. The absence of the challenging behavior for a specified period of time. Answer D. The absence of the challenging behavior for a specified period of time. This question asks about what is reinforced in DRO. Differential reinforcement of other behavior. DRO involves providing reinforcement contingent on the challenging behavior not occurring for a specified duration of time. Interval DRO, or at a specific moment in time, momentary DRO. You reinforce other behaviors, or the absence of any behavior, as long as the target behavior is absent. DRL-A reinforces low rates of the challenging behavior. DRA B. Reinforces a specific alternative. DRI. C. Reinforces a specific incompatible behavior. Jerome rewards them for not doing the problem behavior for a little while. Question 53. Which measurement method is best suited for behaviors that occur at very high rates or are difficult to count as discrete events? A. Frequency. B. Duration. C. Time sampling, example interval recording, momentary time sampling. D. Latency. Answer C. Time sampling, example interval recording, momentary time sampling. This question asks about practical measurement methods for behaviors that happen very frequently or without clear starts/stops, making continuous counting or timing difficult. Time sampling procedures, such as partial interval recording or momentary time sampling, are often used in these situations because they provide an estimate of the behavior's occurrence by sampling it during or at the end of intervals, which is more feasible than trying to capture every single instance of a high-rate behavior. Frequency. A. Is hard for high-rate behaviors. Duration. B. Is hard for brief, rapid behaviors. Latency. D. Measures time to start. When you can't count every single one or time every one, you use time sampling to get an estimate. Question 54. What is the definition of a conditioned punisher? A. A stimulus that is naturally punishing. B. A stimulus that has become punishing through pairing with an unconditioned punisher. C. A consequence that increases behavior. D. A stimulus that signals punishment is coming. Answer B. A stimulus that has become punishing through pairing with an unconditioned punisher. This question asks for the definition of a learned punisher. A conditioned punisher, or secondary punisher, is a stimulus that was initially neutral but became punishing because it was repeatedly paired with an unconditioned, primary, punisher or another established conditioned punisher. Examples might include a specific tone, a look of disapproval, or losing privileges. An unconditioned punisher, A, is naturally punishing. Option C describes reinforcement. Option D describes a stimulus that might precede punishment, not the punisher itself. You learned that this thing is bad because it came with other bad things. Question 55. When assisting with a functional analysis, your supervisor tells you that in the automatic condition, you should provide minimal stimulation and no social interaction. What is the likely purpose of this condition? A. To test if the challenging behavior is maintained by escape. B. To test if the challenging behavior is maintained by attention. C. To test if the challenging behavior is maintained by tangible access. D. To test if the challenging behavior is maintained by sensory consequences, not mediated by others. Answer D. To test if the challenging behavior is maintained by sensory consequences, not mediated by others. This question describes the automatic or alone condition in a functional analysis. In this condition, social consequences, attention, tangible access, and demands are removed or minimized. If the behavior occurs frequently, when the client is alone with little external stimulation and no programmed consequences, it suggests the behavior is automatically reinforced by internal or sensory consequences. Example, it feels good, provides internal stimulation, alleviates pain. Without requiring another person to deliver reinforcement, escape, A, attention, B, and tangible, C, are tested in other conditions. If the behavior happens when no one is there and nothing external is gained, it's likely automatic. Question 56. Which ethical guideline requires RBTs to inform their supervisor immediately of any situation that could reasonably result in harm to a client? A. Confidentiality. B. Professional boundaries. C. Responsibility related to client safety. D. Integrity. Answer C. Responsibility related to client safety. This question addresses the ethical obligation to prioritize client safety and report potential harm. As an RBT, you have a responsibility to protect your client's safety and well-being. If you become aware of anything that could potentially harm the client, abuse, neglect, environmental hazards, unsafe procedures, you must immediately report it to your supervisor so appropriate action can be taken. Confidentiality. A is privacy. Professional boundaries. B are relationships. Integrity. D is honesty. You are responsible for helping keep the client safe, which includes reporting any potential danger. Question 57. What is the purpose of thinning a reinforcement schedule? A. To make the behavior stop. B. To make the behavior occur only in the presence of prompts. C. To maintain the behavior with less frequent reinforcement and make it more resistant to extinction. D. To increase the client's reliance on continuous reinforcement. Answer. C. To maintain the behavior with less frequent reinforcement and make it more resistant to extinction. This question asks about the reason for moving from CRF to intermittent schedules. Thinning a reinforcement schedule involves gradually reducing the frequency or predictability of reinforcement. Moving from CRF to FR, VR, FI, or VI schedules. This is done after the behavior is learned to maintain it with less reinforcement, make it more efficient, and make the behavior more likely to continue even if reinforcement is not always available, more resistant to extinction. Making the behavior stop, A, is extinction. Prompt dependency, B, and reliance on CRF. D are undesirable outcomes. Thinning makes the behavior stronger and last longer even without getting a reward every single time. Question 58. Which ethical guideline requires RBTs to practice only under the supervision of a qualified BCBA or BCABA? A. Confidentiality. B. Professional boundaries. C. Scope of practice. D. Responsibility. Answer. C. Scope of practice. This question asks about working within your defined professional role. RBTs are defined as paraprofessionals who must deliver services under the supervision of a certified behavior analyst. It is outside the RBT's scope of practice to work independently without this required supervision. Confidentiality. A is privacy. Professional boundaries. B are relationships. Responsibility. D is duty. You must always work under the direction of your BCBA or BCABA supervisor. Question 59. When graphing frequency data, what does it mean if the data path shows a consistently downward trend across an intervention phase? A. The behavior is increasing. B. The behavior is stable. C. The intervention is likely effective in decreasing the behavior. D. The measurement method is inappropriate. Answer. C. The intervention is likely effective in decreasing the behavior. This question asks about interpreting a graph showing a downward trend during intervention. A consistently downward trend indicates that the frequency of the behavior is generally decreasing over time during that phase. If this trend occurs after implementing an intervention, it visually suggests that the intervention is likely having the desired effect of decreasing the behavior. Increasing behavior, A, is an upward trend. Stable behavior, B, is a flat trend, while measurement is always important. D, a clear trend suggests the measurement is capturing change. A line going down during intervention is usually a good sign that the plan is working to reduce the behavior. Question 60. What is the definition of a conditioned stimulus, CS, in classical conditioning, and how does it relate to ABA concepts like conditioned reinforcers? A naturally occurring stimulus that elicits a reflex, similar to a primary reinforcer. B. A previously neutral stimulus that, through pairing with an unconditioned stimulus, comes to elicit a conditioned response. It's the stimulus aspect of establishing a conditioned reinforcer. C. A stimulus that signals reinforcement is available, similar to an SD. D. A consequence that increases behavior, similar to a conditioned reinforcer. Answer. B. A previously neutral stimulus that, through pairing with an unconditioned stimulus, comes to elicit a conditioned response. It's the stimulus aspect of establishing a conditioned reinforcer. This question dips into classical conditioning terms and links them to ABA. In classical conditioning, a neutral stimulus, NS, is paired with an unconditioned stimulus, US, naturally elicits a response. After pairing, the NS becomes a conditioned stimulus, CS, eliciting a conditioned response, CR. When establishing a conditioned reinforcer in ABA, a neutral stimulus, like a token, is paired with an existing reinforcer, an unconditioned or conditioned stimulus that functions as a reinforcer. The neutral stimulus becomes a CS because it predicts reinforcement, and this CS then becomes a conditioned reinforcer. Option A describes an unconditioned stimulus. Option C describes an SD from operant conditioning. Option D describes reinforcement. The CS is the neutral thing that gets linked to something else and starts to predict it, which is part of how a neutral item becomes a learned reward. Question 61. When measuring behavior using partial interval recording, what is a common effect on the data? A. It tends to underestimate the duration of the behavior. B. It tends to overestimate the frequency or duration of the behavior. C. It provides an exact measure of frequency. D. It measures the time between behaviors. Answer B. It tends to overestimate the frequency or duration of the behavior. This question asks about a known characteristic of partial interval recording data. Because you mark yes if the behavior occurs at any point in the interval, even for a second, this method is likely to overestimate how often or how long the behavior actually occurred compared to continuous measurement. It's sensitive to behaviors that happen briefly. Underestimating duration, A, is more like whole interval. Exact frequency, C, requires continuous measurement. Time between behaviors, D, is IRT. Partial interval tends to make the behavior look like it's happening more than it really is, because even a tiny bit counts for the whole time box. Question 62. What is the ethical guideline that requires RBTs to maintain appropriate professional distance from clients and their families? A. Confidentiality. B. Dual relationships/professional boundaries. C. Integrity. D. Cultural responsiveness. Answer B. Dual relationships/professional boundaries. This question asks about keeping the relationship professional. Maintaining professional boundaries involves ensuring your interactions and relationship with clients and their families remain focused on the therapeutic goals and avoid becoming overly personal. Example, becoming close friends, engaging in social activities outside of therapy. This helps prevent the blurring of lines that could lead to dual relationships and potential ethical issues. Confidentiality, A, is privacy. Integrity, C, is honesty. Cultural responsiveness, D, is respecting culture. Keep the relationship professional and avoid mixing personal life with therapy. Question 63. What is the definition of maintenance in ABA? A, the client performs the skill in new environments. B, the client uses different responses to get the same outcome. C, the client continues to perform a learned skill after intervention is faded or removed. D, the client responds differently to different stimuli. Answer C, the client continues to perform a learned skill after intervention is faded or removed. This question is identical to question 50. Let's replace it with a new question. REVISAD question 63. When using a token economy, how does a token acquire reinforcing properties? A, it is a primary reinforcer from birth. B, its value is learned by pairing it with backup reinforcers. C, it is a natural consequence of behavior. D, it signals the start of a therapy session. Answer B, its value is learned by pairing it with backup reinforcers. This question asks how tokens become rewards. Tokens are conditioned reinforcers, meaning their value is not inherent, but is learned through association. They acquire reinforcing properties because they are consistently paired with or can be exchanged for other stimuli that are already reinforcing. The backup reinforcers. They are not primary reinforcers. A. Although they might be exchanged for them, they are not natural consequences. C. As they are delivered as part of a planned system. They don't signal the start of a session. D. Tokens become rewarding because you learn they get you things you already like. Question 64. When is it ethically required to obtain assent from a client? A. Whenever the client is a minor. B. When the client is unable to provide formal informed consent, but is able to show willingness or unwillingness to participate. C. Only for restrictive procedures. D. Never only formal consent from a legal guardian is needed. Answer. B. When the client is unable to provide formal informed consent, but is able to show willingness or unwillingness to participate. This question addresses the ethical concept of assent. While formal legal informed consent is obtained from a parent or legal guardian for clients unable to consent for themselves, ethically, it is crucial to respect the client's own willingness to participate. Assent is the verbal or nonverbal agreement or compliance from a client who cannot give full legal consent. You should attempt to gain assent and respect dissent, unless safety is an issue, showing respect for the client's autonomy to the extent possible. It applies when formal consent isn't possible, but the client can still communicate willingness. Respecting the client's willingness is important, especially when they can't give full legal consent. Question 65. What is the ethical guideline that prohibits RBTs from practicing or offering services outside of their defined scope of practice? A. Integrity. B. Professional boundaries. C. Competence. D. Responsibility. Answer. C. Competence. This question asks about the ethical principle of ensuring you have the skills and knowledge for your job. Professional competence means having the necessary qualifications, training, experience, and supervision to perform your professional duties effectively and safely. Practicing outside your defined role as an RBT, implementing under supervision, or attempting procedures you are not trained in violates this principle. Integrity. A. Is honesty. Professional boundaries. B. Are relationships. Responsibility. D. Is duties. Make sure you are trained and qualified for everything you do with clients. Question 66. When implementing a behavior reduction plan, what is the primary benefit of teaching and reinforcing a replacement behavior? A. It makes the challenging behavior extinguish faster. B. It gives the client a functional way to get their needs met. C. It prevents extinction bursts. D. It makes data collection easier. Answer. B. It gives the client a functional way to get their needs met. This question asks about the importance of teaching replacement behaviors. When reducing a challenging behavior, it's crucial to teach the client a new appropriate behavior that serves the same function, gets them the same outcome as the challenging behavior. This provides them with a functional alternative to get their needs met, making the challenging behavior unnecessary and promoting positive skills. It can sometimes help extinction. A. But that's not the primary benefit. It doesn't prevent extinction bursts. C. It doesn't necessarily make data easier. D. Give them a better way to get what they want or need instead of the problem behavior. Question 67. What is the definition of a discrete trial? A. A trial that occurs naturally in the environment. B. A trial conducted without any prompting. C. A structured teaching unit with a clear beginning and end. D. A trial where the client makes an error. Answer. C. A structured teaching unit with a clear beginning and end. This question asks for the definition of a discrete trial, often used in DTT. A discrete trial is a structured teaching opportunity that has a clear start, presentation of the SD, a distinct response interval for the client, a consequence delivered contingent on the response, and a brief inter-trial interval before the next trial begins. It's a distinct, controlled teaching unit. Naturalistic teaching. A. Happens in the environment. Prompts may or may not be used. B. It can result in correct or incorrect responses. C. A discrete trial is a mini-lesson with clear steps. Question 68. Which ethical guideline requires RBTs to be honest and truthful in their professional conduct? A. Confidentiality. B. Integrity. C. Professional boundaries. D. Responsibility. Answer B. Integrity. This question is identical to questions 20 and 61. Let's replace it with a new question. RBT question 68. When measuring behavior using whole interval recording, what is a common effect on the data? A. It tends to overestimate the occurrence of the behavior. B. It tends to underestimate the occurrence of the behavior. C. It provides an exact measure of frequency. D. It is only used for behaviors that are increasing. Answer B. It tends to underestimate the occurrence of the behavior. This question asks about a known characteristic of whole interval recording data, because you only mark yes if the behavior occurs continuously for the entire interval. This method is likely to underestimate the actual frequency or duration of the behavior, especially if the behavior is brief or intermittent. Overestimating, A, is more like partial interval. Exact frequency, C, requires continuous measurement. It can be used for behaviors that are decreasing or increasing. D, though it's often favored for increasing behaviors due to the underestimation. Because the behavior has to fill the whole time box, you often miss instances, making it look like the behavior happens less than it does. Question 69. When using a least to most prompting strategy, you increase the intrusiveness of the prompt if the client A. Responds correctly with the current prompt. B. Does not respond or responds incorrectly after the SD and current prompt. C. Engages in challenging behavior. D. Completes the task independently. Answer B. Does not respond or responds incorrectly after the SD and current prompt. This question asks about when you move up the hierarchy in LTM prompting. In least to most, you provide the SD, wait for a response, with or without the initial least intrusive prompt. And if the client does not respond or responds incorrectly after a set time, you then provide the next prompt in your hierarchy, which is more intrusive. If they respond correctly, D, you provide reinforcement and potentially plan to fade prompts further. Challenging behavior, C, might require a different procedure from the behavior plan. You only give more help if the current level of help wasn't enough for a correct response. Question 70. What is the primary difference between a manned and a tact? A. Mands are requests, tacts are labels. B. Mands are controlled by verbal stimuli, tacts are controlled by nonverbal stimuli. C. Mands benefit the speaker, tacts benefit the listener. D. Mands are reinforced by generalized conditioned reinforcement. Tacts are reinforced by specific reinforcement. Answer A. Mands are requests, tacts are labels. This question asks for the core functional distinction between two verbal behaviors. A mand is a verbal response that is a request, controlled by a motivating operation, MO, and reinforced by obtaining the requested item or action. A tact is a verbal response that labels or names something in the environment, controlled by a nonverbal stimulus, and typically reinforced by generalized conditioned reinforcement, like praise. While B is often true, it's not the primary functional difference. C is often the outcome. D is generally true about typical reinforcement, but isn't the core definition of the operants. Mands are asking for something. Tacts are naming something. Question 71. What is the ethical guideline that requires RBTs to avoid conflicts of interest? A. Confidentiality. B. Integrity. C. Avoiding exploitation/conflict of interest. D. Professional boundaries. Answer C. Avoiding exploitation/conflict of interest. This question asks about the ethical principle regarding situations where personal interests could improperly influence professional judgment or actions. A conflict of interest arises when an RBT's personal or financial interests could interfere with their ability to act solely in the client's best interest. Avoiding exploitation, taking advantage of the client, is closely related. Confidentiality, A, is privacy. Integrity, B, is honesty. Professional boundaries, D, are about relationships. Don't let personal things influence your decisions about the client. Question 72. What is the primary purpose of collecting data on a client's behavior? A, to justify billing for services. B, to make objective decisions about treatment effectiveness and guide interventions. C, to complete documentation requirements. D, to show parents that progress is being made. Answer: B, to make objective decisions about treatment effectiveness and guide interventions. This question asks about the core clinical reason for data collection. While data is used for billing, A, documentation, C, and communication with parents, D, the fundamental purpose from an ABA perspective is to provide objective information, facts, about the client's behavior. This data allows the supervisor to visually analyze progress, determine if the interventions are working as planned, and make informed decisions about whether to continue, modify, or discontinue procedures. Data helps the team see if the plan is working and decide what to do next. Question 73. Which type of prompting involves physically guiding the client's body to perform the correct response? A, verbal prompt. B, model prompt. C, gestural prompt. D, physical prompt. Answer: D, physical prompt. This question asks about a specific type of prompt involving touch. A physical prompt involves directly touching or manipulating the client's body to help them complete the desired movement or action, such as hand-over-hand guidance. Verbal prompts: A, use words. Model prompts: B, demonstrate the behavior. Gestural prompts: C, use pointing or motions. Physical prompts are hands-on help. Question 74. What is the ethical responsibility of an RBT if they are unable to implement a portion of the behavior plan due to circumstances, example, missing materials, unexpected environment? A, skip that portion and document why in the notes. B, skip that portion and inform the supervisor later. C, attempt the portion with improvisation. D, inform the supervisor of the issue as soon as possible to determine a plan. Answer: D, inform the supervisor of the issue as soon as possible to determine a plan. This question addresses how to handle unexpected challenges in implementation. If you encounter a situation that prevents you from implementing the plan as written, you must communicate this to your supervisor promptly. They can provide guidance on how to proceed, whether to adapt the plan for the session, focus on other goals, or reschedule. Simply skipping it and documenting. A B means the client isn't receiving planned services without immediate clinical input. Improvisation. C, without supervision, is outside your scope. Communicate with your supervisor right away if you can't implement the plan. If something stops you from doing the plan, tell your supervisor quickly so they can help decide what to do. Question 75. What is the definition of an unconditioned punisher? A, a stimulus that has become punishing through pairing with other punishers. B, a stimulus that is naturally punishing because it causes pain or discomfort. C, a consequence that increases behavior. D, a stimulus that signals punishment is coming. Answer: B, a stimulus that is naturally punishing because it causes pain or discomfort. This question asks for the definition of a primary unlearned punisher. An unconditioned or primary punisher is a stimulus that is naturally punishing without any prior learning history because its presentation causes pain, discomfort, or otherwise decreases behavior without needing to be paired with something else. Examples include extreme heat or cold, loud noises, or pain. Option A describes a conditioned punisher. Option C describes reinforcement. Option D describes a stimulus that might precede punishment. Unconditioned punishers are things that hurt or are naturally unpleasant and make the behavior that caused them less likely. Something that is naturally unpleasant and makes the behavior stop is an unconditioned punisher.